Hi, everyone. I'm Leslyn Keith. I'm president of the board of directors for the Lipedema project, as well as the director of research. And I get together with you every other Thursday, the first and third Thursday of the month, to give you research updates of different papers that have come out of relevance to lipedema. So I'm thrilled to be here with you again today to talk about another paper. And this is actually one that a previous listener that had asked me to look at this paper and present today. So Rosalie suggested this. So please, if you have other papers that you would like me to review and present at these research updates or on the flash briefings, please let me know and I will do them. This is an excellent paper and I'm happy that Rosalie suggested it. This paper we're going to talk about today is called Subcutaneous Adipose Tissue Edema in Lipedema Revealed by Non-Invasive 3T MR Lymphangiography. A very, very well done study, and you'll see as I talk about it. It comes out of Vanderbilt University in Tennessee in the USA, and it was published in the peer-reviewed Journal of Magnetic Resonance Imaging in just May of this year, 2022. So, like I say, a very, very well done study. And so the aim of this study was that they wanted to identify if this imaging technique could identify differences between lipedema, lymphedema, and obesity. And also they hypothesized that this type of imaging would be distinct enough to show differences between these conditions. And they expected that there would be edema that would be found in lipedema fat, that it would be visualized by this imaging technique. So that was our hypothesis. And so, and the reason why they chose to use MR lymphangiography to image in this study was that this had been used previously for people with other lymphatic conditions, lymphedema, and it was very effective in visualizing the edema in lymphedema. And it seemed to be more responsive to the slower moving lymph. So versus blood moving through your body moves at a much faster rate. And so so lymph is much slower, and it seemed to do that really well. And it also seemed to really be able to contrast the lymph from all the other surrounding tissues. So it was easy to see the lymph fluid in those tissues. So were the participants they got for this study. They had 48 participants, average age of 45 and average BMI of 29.6. And so they divided them into 4 groups. One group had just lipedema, a diagnosis of lipedema, and there was 14 in there. 12 were in the lipedema and lymphedema group. 8 had cancer-related lymphedema, either in one or both legs. And they had 14 female controls. So these were 14 participants that did not have lymphedema or lipedema. And so, interestingly, the 4 groups tended to be very, very similar for all the various demographics. But there were some interesting differences. So in the cancer-related lymphedema group, they had the highest average age. They were 54 on average, and the average age of the whole group was 45. And they also had the lowest average muscle area in their legs. And this makes sense because typically you have cancer when you're older, not always, but typically. And so we tend to lose a little bit of muscle mass as we age. And it just means that this cancer-related lymphedema group tended to be older. And then the lipedema, and both the lipedema and the lymphedema groups, they all had a higher pain level than the other groups, and they had a larger leg circumference than the other groups. And this also makes sense because we know that for a lot of women with lipedema, they tend to have pain. Although you can have pain with lymphedema, it's usually more often and more severe in lipedema. And usually the legs can be larger in lipedema. So that made sense too. And then just for some more demographics, as far as which stage the women with lipedema were in, they're most often in stage 2, and this was using a 3-stage model. At Lipedema Simplified, we use a 4-stage model. And so in this model of stage 1, 2, and 3, most of the participants were in stage 2. And in the lymphedema group, most of them were in stage 1. So in the lowest stage of lipedema, or of lymphedema. So how did you get included in the study? Well, you had to be female, and you also had to have either a diagnosis of lipedema, cancer-related lymphedema, either in one or both legs, and lipedema with lymphedema. So then you were put into those 4 groups. But what excluded you from the study? If you had a BMI of over 40, you were excluded. And we'll talk about more about why that higher BMI was excluded. And if you had uncontrolled high blood pressure, if you had diabetes, rheumatoid arthritis, chronic kidney disease, current skin infection, or other signs of acute infection. And it's not that these things would not occur with someone who has lipedema or lymphedema. It's just that we were trying to remove other reasons of edema out of this study population so that we could see, does edema occur in lipedema? And so what did they do? Everybody got a full body MRI, and everybody in the study got both a 2D and a 3D MR lymphangiography without tracer, because remember, this was a non-invasive method of imaging. And they did those 2 images on the calves only. So full body MRI and then the lymphangiography just on the calves. And every one of these images of all, how many was it? 48 participants, was reviewed by 3 different radiologists. And these radiologists did not know what the other radiologists were saying. And they also did not know which group the participant was in. So they didn't know if this is someone with a diagnosis of lipedema or that's a diagnosis of cancer-related lymphedema. They were just imaging those, and it's called being blinded. So they were blinded to what the other reviewers saw, and also what was the diagnosis of the person that they were looking at. So that also really made the study very, very well done. So what were the results? And so this was interesting. Between all 3 of those radiologists, they had very consistent findings. So there was excellent agreement between those radiologists. And that was both to what features they observed and what features they did not observe in each of the different images of all the participants. And they agreed on that the lipedema, lipolymphedema, and lymphedema groups all had edema in the subcutaneous fat and lymphatic impairment compared to controls. And the lipedema group themselves had fluid in the subcutaneous fat, and this was even if they didn't have an overt sign of lymphedema. So in other words, they were not put into the lipolymphedema group. They were just put into the lipedema group, because you couldn't overtly tell, oh, this person has swelling. And so all of them had, on average, they had elevated fluid load in the subcutaneous fat in that group. So conclusions. The researchers felt that this study, the data from this study, suggests that MR lymphangiography can detect the presence of edema and excess fluid load in lipedema tissues even before you have overt or obvious signs of swelling. And so they do believe that this then indicates interventions that are done for edema, such as MLD, compression, pneumatic pumps, that these are indicated actually much earlier before you are diagnosed with lipolymphedema. So you don't have any obvious signs of lymphedema, but it may be indicated to have these treatments earlier. And then they also pointed out in this paper that this type of imaging is used, the MR lymphangiography is used to surveil patients who are at risk for lymphedema. So they've had cancer treatment, they're at risk for lymphedema, and so they use this imaging to keep an eye on them, to monitor them, to see if they are developing lymphedema. And so the researchers felt that this also indicates that maybe this would be a good way to monitor women with lipedema. How are they accommodating any extra fluid load in the tissue? Are they on the verge of developing lymphedema? And they really talk about how this is a non-invasive technique. You're not having to have any needles or injections of anything. And it's offered at many imaging centers. And it may offer earlier detection of edema with lipedema than we've previously done. And then that means that you can get the appropriate treatment sooner. There has been some reports that some papers are saying that obesity, such that it happens so often with lipedema, that is actually the cause of any edema. It's because of obesity. And so there have been other studies that have shown that really you don't have lymphatic failure and edema associated with obesity unless you have a BMI that's over 40. And so this is another reason why the participants in this study had a BMI of less than 40, so that we are now, they're in that area where they're obese, but they're not morbidly obese, and an area, a level of obesity that is known to cause lymphatic failure. And interestingly, in the lipedema group, even the participants in the lipedema group who had a BMI of less than 30, so they were not technically obese, they had a BMI of less than 30, they had lymphatic dysfunction, they had increased lymphatic load, fluid load was detected with this imaging. So this could be also a way of differentiating between lipedema and obesity, or finding if those are two conditions that are together. So that also shows that that you're going to get this fluid load whether or not you have obesity when you have lipedema. And so how is this paper important for women with lipedema? And it's because it is effective for differentiating between other conditions that might be confused with lipedema, such as obesity, and it can offer that early detection of lipedema. And it also justifies the inclusion of interventions such as MLD for lipedema, because there is detectable fluid in those tissues that are much higher than healthy controls. So other papers about lipedema have said that really there is no edema in lipedema, and therefore we do not need any MLD. And some women may have found difficulty getting that intervention covered as part of their treatment. And so this study does show that it does bolster the opinion, the hypothesis that there is edema in lipedema, subcutaneous fat, and that there is a need to have early intervention with MLD, with pumps, with compression, interventions that help with edema, but also help with other symptoms associated with lipedema. So I think this is a very important paper, and it's not the only one that came out this year. There were several very well done studies just this year that are showing that, yes, there is edema associated with lipedema. So I thought this was very, very important. And I'm focusing on, having MLD associated, as part of your overall treatment for your lipedema. And I want to just suggest to you, if you want to find out more about MLD and other physical management strategies for lipedema, come join our CSIG. We're having a coaching special interest group that is starting on Monday, and we're going to focus just on all those different physical management strategies, including all the manual therapies, compression therapy. We'll look at vibration and all kinds of other complementary treatments, as well as skincare. So this is going to be a wonderful CSIG, a wonderful course that's going to be happening through the month of August, that also is going to include group coaching and access to our community. So we'll have the link here for you, and check that out. I think you'll enjoy it. And I also just wanted to check to see who's here today. Holly says, I'm so happy that the live ketogenic solution for lipedema is not the focus of this talk. When I saw that, I was ready to be disappointed, because for me, keto is not an option. Yes. And so that is one of the options. Nutrition in general is one of the options. Of course, I'm very much in favor of a ketogenic diet, restricting carbohydrates, but that is just one of those physical management strategies. And we generally, when we do have a CSIG to focus on these strategies, keto and nutrition is its own course. And so this particular CSIG that I'm telling you about, that's starting on Monday, is going to be all those other physical management strategies. So I hope you can join us. And Kim asks, how do we get a link to this study? And we will try to post it here. I think Holly also posted a link, so I don't know if that is the link to the study, but it is open access, so you would be able to get it. But if you have any difficulty getting this, please email me at leslyn@lipedemaproject.org, and I can send you a copy of the study. And there's several other really good ones too that I would like to do. But because I like to respond to what you're asking me to talk about, I wanted to tell you another person asked me if I would do another paper, the early findings of the Lipedema Foundation Registry Survey. So I will probably be doing that one next. And remember, you can get the research updates on our flash briefings. You can get those at lipedema-simplified.org/flash. And then we have our daily flash briefings that are like a mini podcast. They're like 10 minutes or less. And I do talk about papers there also. And I also talk about it on our blog. And so about every other week, I have a research update blog on the lipedema-simplified.org website as well. So lots of opportunities to find out about different papers of relevance to lipedema. And I just want to check to see if there's any other questions here I should address. Nice to have you all here, and thanks for posting. Holly says, would you please not use the term obesity as a substitute for BMI? Just say BMI if you mean BMI. It is not acceptable to confuse the two. And you're absolutely right, Holly, that they do talk about cutoffs for when you're talking about BMI. And so it's not so much, it's not very applicable to lipedema, as you know. But in general, when we talk about BMI, the cutoff for being obese is 30 or above, and morbidly obese is 40 and above. So I certainly hope I'm not conflating the two, but that's in general how BMI is discussed. And we know that it really isn't a good measure for women with lipedema. And Ksenia, I'm not sure how to pronounce your name, but you asked about a link for the August webcast series. That is actually the coaching special interest group. And I do believe we're going to get that posted, or it is already posted in our chat. So make sure you get that. And Kim suggested that is the link for the paper, so that's good. And if you have tumors that raise your BMI, you do not have BMI. It is really inaccurate. Absolutely. It's such a, BMI is a very gross way of, kind of a global, unspecific way of trying to detect obesity, whether or not you have excess adipose tissue that is actually obesity and not lipedema. And so the BMI is not a good way for differentiating between the two. But in this particular study, because they limited it to participants that had BMI of less than 40, and it was shown in other studies that we didn't have lymphatic failure until there was a BMI of over 40, then we were not conflating another cause, potential cause of there being edema in the lipedema fat, because the participants all had a BMI of less than 40. And so that was the reason why this was the BMI, and talking about BMI and with this study was important, because there are many out there that are trying to say there is no edema with lipedema. And so this is another way to help show that there is a strong possibility that there is edema with lipedema. And DEXA scans, Kim says DEXA scans can help determine level of body fat, possibly, and also bioimpedance is a nice thing to do for body composition and knowing lean mass and water and body fat. And the more expensive bioimpedance devices will actually show you on what part of the body. And we know how that's important for someone with lipedema, because they're not going to have that normal fat distribution. So it's nice to know right leg versus left leg versus the arms versus the trunk. What is the distribution of body fat, lean mass, and water? So, and then I see that the link is being posted about our special interest group. It is comprehensive and creative physical management strategies for lipedema, and I hope you can join us. And I think that is all we're going to talk about today. Okay, I think I got to all the comments. Thank you so much for everybody for participating and being engaged and making comments. I love to have it so I'm not just sitting here alone. Thank you so much, and I'll see you on the first Thursday next month.